Hello everyone. Today we are discussing about the folds of DURAMATER. This is a short essay question and it carries 5 marks. So let us see how to present this answer. If this question is asked, you will have to present this answer under the following headings. First you will say about the meninges, what are the meningeal layers. Then you will say what are the folds of DURAMATER and how these folds are produced. Then you will say the attachment of these folds. You will also say about the sinuses which are lodged in these folds and the functions of these folds. So now we will say about the meninges of the brain. So the meninges of the brain are the dura mater, then we have the arachnoid mater, then we have the pia mater. So these three are the meninges of the brain. So let us see about the dura mater in detail. So dura mater, there are two layers, the outer periosteal layer, inner meningeal layer. The periosteal layer is towards the skull and the meningeal layer is towards the brain. Now what happens is the periosteal layer which is towards the skull and the meningeal layer which is towards the brain, both are joined together in all the places except at some places where the periosteal layer separates from the meningeal layer, and in this place where the periosteal layer and the meningeal layer of the dura mater separate, in such places we have the dural venous sinuses. Now what is the folds of dura mater? As already discussed, so we have the two layers, that is the periosteal layer of the dura mater towards the skull, and then we have the meningeal layer of the dura mater towards the brain. What happens is at certain places the meningeal layer of the dura mater, it folds upon itself, forming folds of dura mater. Now what are these folds of dura mater and what are their functions? These folds of dura mater divide the cranial cavity into compartment, and these compartment, the separate component of brain is placed. We will see about its function in the next few slides. So here you are seeing the folds of dura mater. So you have the FALX cerebri, tentorium cerebelli, FALX cerebelli, and the diaphragma SELLAE. These are the folds of dura mater. You can see here a sickle shaped fold, and that is known as FALX cerebri. Why it is called FALX cerebri? FALX means sickle. This fold of dura mater is sickle shaped, and that is why it is called as FALX. It is called as cerebri because it is present in between the two cerebral hemispheres. Next fold we have is a tentorium cerebelli. So this fold here, that is the tentorium cerebelli. Now this fold actually is called tentorium because it looks like a tent. It is called cerebelli because on the inner aspect cerebellum is lodged. Then we have the FALX cerebelli. Again, FALX means sickle shaped. Cerebelli because it's present in between the cerebellum. Then we have the diaphragma SELLAE. This is the diaphragma SELLAE which roofs over the sella turcica. Let us see each folds in detail. So here in the slide you can see that this is the fold of dura mater which divides the cranial cavity into compartments. As you can see, this is the FALX cerebri and this is the tentorium cerebelli. Tentorium cerebelli, it is called because this fold looks like a tent. See here, this is the tentorium cerebelli. It looks like a tent. So inside the tentorium cerebelli is present the cerebellum, and this is the FALX cerebri. On either side we have the cerebral hemisphere. So let us see about these folds in detail. But what is the function of these folds? As you can see here, these folds of dura mater have divided the cranial cavity into several compartments, and the brain is safely lodged in these compartments. Thereby, injury to the brain is prevented during forceful rotatory movement of the head, which means if these folds were not there, slight movement of the head would damage the brain. The brain would have hit against the hard surface of the skull and the brain tissue would have damaged. So to minimize this, what nature has done, nature has divided the cranial cavity into compartment in such a way that the brain is lodged in compartment, safe and secured. So that is the function of these folds, and also the folds, they lodge the dural venous sinus within them. We will discuss about this later. So first we will discuss the dural folds, which is the FALX cerebri. Now you can see, as already discussed, FALX means sickle shaped. So this is the FALX cerebri. You can see that this fold, it is sickle shaped. That is why it is called FALX. It is called cerebri because on either side of this fold, cerebral hemisphere is present. That is why it is called as FALX cerebri. Now let us see the attachment of the FALX cerebri. So anterior end of the FALX cerebri is attached to this bone, which is called as the crista galli. Now posteriorly, the FALX cerebri is attached to tentorium cerebelli. You can see here the FALX cerebri is attached to the upper surface of tentorium cerebelli. So this is a posterior attachment of FALX cerebri. Then we have the upper convex border, which is attached to the sagittal sulcus in the vault of the skull. Then we have the lower free concave border. So that is about the FALX cerebri. Now let us see what are the sinuses lodged within the FALX cerebri. So to the upper convex margin, there is superior sagittal sinus present. To the posterior two-thirds of the inferior concave margin, we have inferior sagittal sinus. So to the upper convex margin, we have the superior sagittal sinus, and to the posterior two-thirds of the inferior concave free margin, we have inferior sagittal sinus. The junction where the FALX cerebri attaches to the tentorium cerebelli, there is present the straight sinus. So this sinus here is called as the straight sinus. So that was about the FALX cerebri. Next we will see the tentorium cerebelli. As you can see here, this is the FALX cerebri and this is the tentorium cerebelli. It is called tentorium cerebelli because this fold, you can see here, this fold looks like a tent, and what happens is the FALX cerebri, you can see here, the FALX cerebri is attaching to the upper surface of tentorium cerebelli, thereby it pulls the upper surface of the tentorium cerebelli and makes it looks like a tent. That is why it is called tentorium cerebelli, because on the inner surface tentorium cerebelli, we have the cerebellum placed. That is why it is called as tentorium cerebelli. So here you can see, this is the tentorium cerebelli. As you can see, it has two folds. This is the free margin of the tentorium cerebelli and this is the attached margin of the tentorium cerebelli. Let us see the attachment of the free and the fixed margin of the tentorium cerebelli. As you can see here, this is the anterior clinoid process. So the free margin, so we can see here the free margin of the tentorium cerebelli. I am talking about this margin. This is the free margin of tentorium cerebelli. It is attached from one anterior clinoid process to another anterior clinoid process. So this is the free margin of tentorium cerebelli. The space inside this is known as tentorial notch. This space in between the U-shaped letter is known as tentorial notch, and midbrain is present inside this notch. So this notch, the space here, that is known as tentorial notch, and midbrain is present within this notch. Now let us see about the fixed or the attached margin of tentorium cerebelli. Now we are talking about this part. So now we are talking about this part, which is the fixed margin of the tentorium cerebelli. So the fixed part of the tentorium cerebelli is attached to the internal occipital protuberance. It is attached to the transverse sulcus. It is attached to the petrosal part of the temporal bone, petrous part of the temporal bone, and it is attached to the posterior clinoid process. It is attached to the posterior clinoid process. So this is the attachment of tentorium cerebelli. As already discussed, this was the free margin of tentorium cerebelli and this was the attached margin of the tentorium cerebelli. The space here in between the free margin of tentorium cerebelli is called as tentorial notch and midbrain is present within that. Now let us see what are the sinuses present within the tentorium cerebelli. As you can see here, this is the tentorium cerebelli. So this is the tentorium cerebelli here. The sinuses present here is the transverse sinus. Then we have the superior petrosal sinus. This is the superior petrosal sinus. So we have the transverse sinus and the superior petrosal sinus. Now there is something called as oculomotor trigone. Let us see what it is. As already discussed, we discussed that free margin of tentorium cerebelli is attached from one clinoid process, anterior clinoid process, to another anterior clinoid process. We also studied that the attached margin of the tentorium cerebelli or the attached portion of tentorium cerebelli is attached to the internal occipital protuberance, the transverse sulcus, the petrous part of the temporal bone, and then to the posterior clinoid process. So this is the attached margin of the tentorium cerebelli. Now if you observe carefully, between the free margin and the attached margin, we have a triangular shape area here, the triangular space here. This is known as the oculomotor trigone, and the third cranial nerve or the oculomotor nerve comes out or is present in this triangle, and that triangle is known as oculomotor trigone. So basically it is the space in between the free portion and the attached portion of the tentorium cerebelli. Now we have something which is called as the Meckel's cave. Let us see what it is. So as already discussed, the free portion of tentorium cerebelli is from one anterior clinoid process to another anterior clinoid process, and the attached portion of tentorium cerebelli is from the internal occipital protuberance to the transverse sulcus to the petrous part of the temporal bone to the posterior clinoid process. So this is the attached portion. Now as the attached portion of the fold is passing through this petrous part of the temporal bone, it covers a part here. It covers a ganglia, the trigeminal ganglia, and this part is known as the Meckel's cave. So if you reflect this part of the dural pouch, you will get trigeminal ganglia here. So this cave is known as the Meckel's cave. So you can see here, if I reflect this part of the fold of DURAMATER, I will be seeing this trigeminal ganglia here. So that is the Meckel's cave. Now we will see the diaphragma SELLAE. So the attachment of this is anteriorly it is attached to the tuberculum SELLAE and posteriorly it is attached to the dorsum SELLAE. So this is the diaphragma SELLAE. Now what are the sinuses present here? So we have here we have the cavernous sinus on both the sides. So we have anterior intercavernous sinus, posterior intercavernous sinus present within this fold of DURAMATER. And what is this diaphragma SELLAE pierced by? The stalk of the infundibulum, because hypophysis cerebri is present inside this fold. As already discussed, anterior and posterior intercavernous sinuses present in this fold of DURAMATER. Now we have the last fold, that is the FALX cerebelli. You can see here, this is the FALX cerebelli. The attachment is from internal occipital protuberance, internal occipital crest. So this is the FALX cerebelli. It is called FALX because again this is sickle shaped. Cerebelli because on either side you will have the cerebellum. Now if you see here the attachment, the base, if you can see here, this is the base of the FALX cerebelli, and this is the apex. So apex is free in between the cerebellum, whereas base is attached to the undersurface of tentorium cerebelli. What is the sinus present here? We have the occipital sinus, which is lodged in the FALX cerebelli. So the sinus lodged is the occipital sinus. So this is about the FALX cerebelli. So that was about today's topic. Thank you so much for watching this video.